beyond. But first, let's talk about looking good and feeling good. And Jay Paul, our director, if we can meet the very lovely, our special guest, Dr. Gretchen Velazquez. She's a first-time guest to the program, and she's with Cornerstone Internal Medicine at Premier. Welcome, Doc. How you doing?
Very good. Thank you for having me.
How long have you been practicing medicine?
I have been in private practice for 6 years.
Okay, because you only look like 10, so something's going on there. Hey, let's talk about this medical skin treatments that keep us looking young. So my question is, if everybody wants to look younger these days, and I'm assuming that's the proper term to use because we hear about it so much on TV, what are some of the things that you recommend for adult patients to achieve this a feeling of looking good and feeling good?
Well, in general, most people should have the goal of taking care of themselves by exercising. Regular aerobic exercise is the easiest way to feel energetic and to feel young. Also having a balanced diet, eating properly. A lot of people try to take supplements and vitamin this and supplement that, and you're not going to get more from a set of pills and bottles that you bought at the Earth
store or wherever.
Store, yeah. You can obtain the same nutrients by eating a balanced diet.
And it's harder. I mean, it's harder work. You have to fix things and make sure you're getting the right foods in the mix and do the exercise. So I think we're always looking for a quick fix, aren't we? Isn't that just human nature, though?
Yeah, yeah.
You have patients come to you and say, fix me up quick or something? And
sure. And there are some shortcuts. You should take care of yourself and drink plenty of water. Try to avoid drinks that are going to dehydrate you, like caffeine, sodas.
So caffeine does dehydrate. I didn't know that.
Absolutely. Yeah, alcohol will too. Some people take alcohol to help them sleep, the proverbial glass of wine at night.
The hot toddy before bedtime.
That can...
That's a myth?
That can disturb your sleep. That can disturb your REM cycle through the night.
I didn't realize that. I'm in REM right now. There are, what kind of treatments do you prescribe that are available out there? Products, procedures, you turn on TV, you go on the internet, hey, look younger, get this pill, get this treatment, get this injection. And it's very confusing when you hear all this. How do you sort all this out for us?
Absolutely. I am an advocate of medical-grade cosmeceuticals. And that means that you can obtain very effective products through a doctor's office or a medical spa that typically is run by a physician. Products like what? I mean, we don't have to do an advertisement necessarily, but I mean, what are you talking about? Creams, injections? Sure, a combination of products. A simple way to do it for women, maybe starting in their 30s when you start to see some of the early sun damage and aging changes in the skin. Using cosmeceuticals that have glycolic acid, for example, or salicylic acid if you have acne. Now, there's some over-the-counter products you can buy at the counters at the department stores. Those are not the same products, even though they're just as expensive as the ones you can get at your doctor's office. So you have to be really sure. So, and the other thing is asking the right kind of questions of your doctor. Get in there from the get-go and sit down with you, and it's almost like you're going to do a consultation. And before you do anything, they want to know all about this. Absolutely. What is there one? We have just a few seconds left. Is there any one treatment short of plastic surgery that you recommend? Botox and Juvederm are wonderful treatments. I perform both of them. I'm also the medical director for advanced laser and skin rejuvenation, and I also do those treatments there. Well, that's great. Let's, before we lose time here, let's put up this on the screen, www.cornerstonehealth.com. And sometime I want to get you back, find out more about you and how you came to us from Puerto Rico, and we're so glad to have you here in the area, and great information. Will you come back sometime? Thank you, absolutely. All right. We'll be right back after this.